Hello everyone, thank you very much for watching this video. I'm Raja Mehanna. I am the scientific website editor for the PRD, and today I have the honor to be joined by Dr. Joseph Jankovic. Dr. Jankovic, hello.
Hello, Raja. It's good to see you.
Good to see you as well. Thank you so much for joining us, Dr. Jankovic. And today we're going to discuss your article, Essential Tremor as Prodromal Feature of Parkinson's Disease, which was published in the November issue of the journal Parkinsonism and Related Disorders. By the title of your article, you present essential tremor as a possible prodromal feature of Parkinson's disease. So which patients, in your opinion, with essential tremor are at risk to evolve into Parkinson's disease?
So, just by way of background, I've been interested, as you know, in the relationship, between essential tremor and Parkinson's disease for a long, long time. And, one of the advantages of having gray hair is that I get to see patients initially and then follow them for years or decades. And I soon realized that, patients with essential tremor later, over a period of maybe years or decades, start to develop Parkinsonian features. And as you know, according to the new consensus definition of essential tremor is sort of divided between pure essential tremor and essential tremor plus. So I've been seeing more and more patients with essential tremor plus, ET plus, because they also have coexistent Parkinsonian features. I've been, obviously very interested in this idea that some patients with essential tremor later develop Parkinson, and as such, essential tremor could be viewed as a potential prodromal feature of Parkinson's disease.
And so you feel that patients with essential tremor plus are more at risk to evolve into Parkinson's disease versus those who have pure essential tremor?
Right. So even patients with pure essential tremor, in my opinion, are at an increased risk for developing Parkinson. But certainly patients with essential tremor who start developing Parkinsonian features, such as, for example, slight, bradykinesia or rest tremor, they obviously are at a higher risk for developing Parkinson. And that is actually illustrated by a number of studies, including a variety of longitudinal prospective studies that we cited, in the paper. And more recently, something that has not yet been published, but we presented the data at the MDS Congress in Philadelphia. When we look at skin biopsy of patients with essential tremor, what we found, to our surprise, is that majority of patients with essential tremor actually have abnormal skin biopsy showing phosphorylated alpha-synuclein in their skin. I suspected that more patients with essential tremor than healthy controls would have this abnormal finding, but what was surprising to us was that about 57% of patients with pure essential tremor had abnormal skin biopsy, and over 60% of patients with ET plus had abnormal skin biopsy. So that is really quite surprising. Obviously, it has to be confirmed. The data we presented in the poster at the MDS Congress was preliminary data, only a small number of subjects. I think we had only about 31 patients with essential tremor, but we are enlarging the study, and we have now done a skin biopsy on over 100 patients with essential tremor, and we are seeing pretty much the same trend. So that alone, to me, suggests that some patients with essential tremor actually have underlying synucleinopathy, and as such, could be considered as a prodromal feature of Parkinson's disease. And there are many other studies that suggest that essential tremor have other risk factors for Parkinson's disease. For example, there are studies that show that patients with essential tremor are at a higher risk of having RBD and behavioral disorder, or they may have abnormal DAT scan or smell test. All of these features that we use to indicate that an individual is at risk for developing Parkinson's disease.
Fascinating. Thank you so much. So if you have a patient with Parkinson's disease or two patients with Parkinson's disease, are they different if one of them had essential tremor before versus the other who did not have essential tremor before?
So as you know, I'm very interested not only in the relationship between ET and PD, but also in PD subtypes. And a long time ago, we suggested there are two major subtypes of Parkinson's disease: tremor dominant form of Parkinson and PIGD, or partial instability gait difficulty form of Parkinson's disease. And those two subtypes have subsequently been confirmed by other studies. So when it comes to a relationship between ET and PD, it turns out that the ET predominant PD is more likely to have a pre-existent essential tremor. And the point I want to make, especially for the trainees in the audience, is that when you see a patient with Parkinson's disease and the patient says, I first noticed tremor in the right hand. Well, you should never be satisfied with that statement. You should immediately follow up with the following question: have you ever noticed any type of tremor even prior to this right hand tremor? And it's amazing how often you find that patients will say, oh yeah, I've had tremor all my life, but everybody else in my family has it, so I don't really pay much attention to it. It's not until the tremor occurs at rest and may be associated with other Parkinsonian features that the patients start paying attention to the tremors. So I strongly urge the trainees in the audience to always follow up with their questioning and trying to make sure that the patients understand your question. When was it the very, very first time you ever noticed any kind of tremor, not just the tremor that you experience right now in your right hand?
Yes, absolutely. When I was your fellow, would ask the patient, like when you were in college, it's very stressed and all those finals and exams, would you shake it just a little bit in your hands? And more often than not, the answer was yes. That's I do remember this pretty well.
Let me just clarify that. So this doesn't necessarily mean that somebody who has stress-induced tremor has essential tremors, but many patients have tremor that they attribute to stress, but it turns out it's essential tremor. The patients, have family history, they respond to alcohol, and they have all the other features of essential tremor. So I don't want to confuse essential tremor with enhanced physiologic tremor.
Yeah, thank you for the clarification. So are there any biomarkers to identify people with essential tremor?
That eventually may develop Parkinson's disease? Is that what you mean? Or as you know, we don't have a diagnostic test for essential tremor, and there are really no specific biomarkers for essential tremor. And even though essential tremor is one of the most common genetic disorders, we still don't know which gene or genes cause essential tremor. It would be wonderful to have a genetic biomarker, but we don't. But I alluded to one of the potential biomarkers, namely skin biopsy, which is not necessarily a biomarker for essential tremor, in my opinion, but it's a biomarker for potentially increased risk for Parkinson's disease. The DAT scan sometimes is helpful. It's amazing how often you see a patient with essential tremor, you go order a DAT scan, and the DAT scan is abnormal. That doesn't necessarily mean that the patient has coexistent Parkinson, but at least it suggests that they may be at risk for developing Parkinson down the road. But obviously, we would like to have more specific, more sensitive biomarker for patients with essential tremor who later develop Parkinson's disease. The skin biopsy certainly, I think, might be helpful.
So then, in your opinion, Dr. Jankovic, do you feel essential tremor is a risk factor for Parkinson's disease, or is it a prodrome of Parkinson's disease?
Well, it's a good question, and I'm not sure exactly how to answer it. I think essential tremor is a risk factor for Parkinson's disease in a subset of patients with essential tremor. I don't want to say that every patient with essential tremor later develops Parkinson. that's definitely not what I'm saying. But there is a subset of patients with essential tremor who I think is at a high risk for developing Parkinson. We are trying to identify, biomarkers that might tell us which individuals with essential tremor are at an increased risk for Parkinson's disease. I mentioned the skin biopsy, DAT scan. Those are some of the potential biomarkers that may help us identify those individuals at risk for Parkinson.
Well, thank you very much, Dr. Jankovic, for your time and for all these answers. As a reminder, the full article is available in Parkinsonism and Related Disorders, the issue of November. Thank you so much, Dr. Jankovic.
Thank you.